become more and more advanced, from youth sports to high school, college to pros. Siouxland athletes can face any number of injuries. Tonight, we're talking to the experts. We have a team of doctors from CNOS with us in our studios to answer your questions. Recovery Road, inside sports medicine. Now, here are your hosts, Matt Breen and Jessica Bowman.
And good evening, everyone. Thanks for joining us for this KTIV News 4 special report, Recovery Road, Inside Sports Medicine. I'm Matt Breen.
And I'm Jessica Bowman. Tonight, we'll talk with 6 doctors about sports medicine. Injuries are especially common in athletes, and the doctors in our studio tonight are the ones that lead Siouxland athletes through their recovery and back to the sport they love.
To start, let's introduce you to the doctors we have with us in studio. This is Dr. Joshua Locker. Locker is a board-certified orthopedic surgeon specializing in sports medicine. He earned his bachelor's degree from Northwestern College in Orange City, Iowa, and his medical degree from the University of Iowa's Carver College of Medicine. Dr. Ryan Meese is a board-certified orthopedic surgeon specializing in sports medicine and surgeries of the knee, shoulder, and elbow. He graduated from Morningside University and went to Creighton University for medical school. He then moved on to Madison, Wisconsin for an orthopedic surgery residency. He's now been with CNOS since 2005. Dr. Pinnett Physical is a board-certified orthopedic surgeon specializing in foot and ankle surgery, sports medicine, and stem cell therapy. Dr. Physical has extensive clinical experience in taking care of complex foot and ankle conditions from a 10-year practice at the University of Iowa.
Dr. Brian Johnson is a board-certified orthopedic surgeon who specializes in sports medicine and joint replacements, including complex shoulder and knee reconstructions, along with stem cell therapy. Dr. Johnson received his undergraduate degree in molecular biology from Brown University. He then attended the University of Texas, Houston School of Medicine. Dr. Ben Bissell is a board-certified orthopedic surgeon specializing in sports medicine, general orthopedics, and PRP therapy. His expertise includes joint replacement surgeries, and Dr. Bissell received his undergraduate in biochemistry from the University of Nebraska-Lincoln and continued his medical education at the University Nebraska College of Medicine. Dr. Joseph Carreau is a board-certified orthopedic surgeon specializing in sports medicine, knee and shoulder joint replacement surgery, as well as stem cell therapy. Dr. Carreau received his undergraduate education from Colorado State University and received his medical education from Creighton University School of Medicine and Residency University of California, San Diego, followed by fellowship at the University of Iowa. The panel of doctors are ready to answer your sports-related injury questions right now. You can send your questions to connect@ktiv.com.
Now, we already have a long list of questions for our doctors, but Dr. Locker, I want to start with you. We're focusing on sports-related injuries tonight, but how often do you see patients that suffer injuries doing something other than sports, just doing those everyday activities?
Yeah, we see it quite commonly, really every day we see that, whether it's a fall on the ice or out doing yard work or even on the job. A lot of those same injuries can happen outside of a sports scenario, so a very common thing we see.
Dr. Meese, I want to ask you, there are a lot of steps when you diagnose an injury. When an athlete comes to you with an injury, how do you diagnose their injury and then determine the best way to get them back to their sport?
You know, the first thing all these kids that come in with an injury want to know is, number one, what's wrong and when can I play again? That's all they really care about. And some of these things we can get a pretty good feel for just by examining them and hearing their history. But other times we need an x-ray, and sometimes that's enough to give us some sense of whether this is a minor injury that can go back and play again. And perhaps it's something that is not dangerous to continue to play with. Other times there are injuries that might be a little bit more concerning. If they went back to play, they could cause further harm to their joint, whether it's an injury to their ACL or something with their shoulder. And those oftentimes will have to shut down a little bit longer, maybe get advanced imaging like an MRI study. And so typically between the exam and the imaging studies, we'll have a pretty good idea of what's happening. As
a parent of an athlete, I have to ask you, which is harder to deal with, the athlete that wants to get back on the field or the parent that just wants their athlete to get better?
I would say it's equally complex, and those two sometimes are competing variables.
All right. Thank you, Dr. Meese. Now, injuries can happen all the time. We want to focus on ankle injuries. Dr. Physical, that is your specialty. What is the best way to prevent those recurring injuries by spraining those ankles over and over again?
Yeah, so it's a common problem, as you know. It depends on how bad the situation has been. If an athlete has been having so many sprains, one thing that we need to keep an eye on is that a permanent damage to a ligament that make it so loose to the point that, it's gonna continue to sprain. So in that category, we might need to make sure you go see a therapist, a trainer, or orthopedic surgeons. We can actually diagnose ankle sprain and instability very, very quickly. Usually within a few minutes of doing a good examination, we can tell if there's anything wrong inside. If they are doing pretty good, the ligaments are intact and the ankle is in good function, usually to prevent, we need to make sure we have good conditioning, going back to sports, wearing good ankle bracing, good shoes, and maybe making sure we go back slowly. Don't go back to the game right away. Maybe do some practice, ease into it.
And a follow-up, how important is it for the athlete to follow the physical therapist's instructions and take their time in working back to their sport?
Really critical. It is like the key, because if you don't listen, you go on your way, you might have an injury, and then you have a setback, more injury, and then it would take more time to go back to sports.
Yeah, chances are they're back in your office sooner rather than later.
Which we don't like that, yeah.
We have a question from a viewer, folks. Dr. Meese, this is for you. What's your go-to medicine for pain, especially with the opioid epidemic?
Well, it certainly has been an issue with opioids, and so what we try to do is to use everything we can and kind of attack this from a multimodal perspective. There are different pain receptors affected by different medications, and so sometimes even in a more severe injury, something as simple as taking an anti-inflammatory like ibuprofen or Aleve, or a prescription one like meloxicam, in addition to extra-strength Tylenol, is enough to handle the pain for these patients. If there's more pain, we kind of start with that and slowly build up, and maybe we move on to something like a muscle relaxer such as cyclobenzaprine, still much less habit-forming than a narcotic, and even tramadol, which is a lower-strength pain medication, and then even modalities like heat and ice and what they can do in physical therapy. The goal is really to get somebody through an injury and operation with as little narcotic as possible, and oftentimes they won't need any for a minor surgery. And if they do utilize something stronger, like a narcotic such as hydrocodone or oxycodone, we try to have them off that medication as quickly as possible, within a few days. And we make that very clear to them. And I think if you educate the patient on what we're trying to do, they will often be able to follow those instructions better. If you throw a bunch of narcotics at them, they will take them just not knowing that they should be doing something different.
All right. Dr. Meese, thank you.
But,
And if you have a question for our panel of doctors, you can send them to connect@ktiv.com. The doctors might answer your question on the air. Improving health one step at a time. Sports injuries can be unique circumstances where specialty training really comes into play. Now, a lot of time, focus, and passion for the work at hand. Dr. Johnson, what do you find most rewarding about your work with athletes and their injuries?
I think any kind of injury that an athlete has is a metaphor for life. We all have setbacks, and we all have to make good decisions and then attack that problem to get us back in whatever game we're focusing on. I love athletes because they're always dedicated, they're always sincere, they're authentic, and they are going to do their training, and I think that affects their outcome. It's also very rewarding to do surgeries. It's a privilege to take care of people that are going to get better. There's a lot of problems in medicine, like end-stage cancer or things that need good doctors, but they don't get better. These kind of problems can get better, and it's a privilege to be a part of that.
Dr. Johnson, thank you for that. And comprehensive training and treatment is crucial to getting athletes back to the game. And there is an entire team working together to make all this happen. So, Dr. Bissell, this question is for you. How do you work with physical therapists and athletic trainers to support athletes in their recovery after surgery?
As you mentioned, it's really a team effort to get these athletes back on the field. Every part of the team is vital. And so I don't get to spend as much time with the athlete as the trainers and the physical therapists. I might do a surgery or see them in the office, but the trainers and the physical therapists get to spend a lot of time with them, getting them on their road to recovery. And every injury and surgery is different in regards to what is the right and wrong thing to do to get yourself better. So they really guide them along on that process, make sure they aren't moving too quickly. With athletes, they tend to try to get back as quick as they can. They might try to go too quickly and make their injury worse. So they're just a vital part of the team and really a key. And we just have to communicate with each other. They let the therapists and trainers let me know what they're seeing and likewise. So.
All right, Dr. Bissell, thank you for that answer. And another element very important on the recovery road is technology. And Dr. Crow, how has technology evolved since you first started, or maybe changed when it comes to surgical interventions with a sports injury?
Sure. Yeah, good question. I would say that industry overall has really advanced technology. So the implants we use, the anchors, the sutures, all those things available have really allowed us to do what was traditionally a very big surgery through a less invasive approach. So with the advancement of the technology, we can do the same big surgery with arguably maybe a quicker recovery and less pain. Some of the challenge still exists, though, that despite the tools we have to set somebody up to heal, we're still relying on the patient to heal that broken bone or torn ligament. So I think a lot of the advances in the future are going to be centered around biologics, augmenting a healing response to try to get people to heal quicker.
Is it really surprising to see how much technology has advanced?
Yeah, it sure is.
All right, Dr. Carrillo, thank you for that. And of course, as we continue tonight's live coverage, we want you to join in on the live conversation. Recovery Road, Inside Sports Medicine. We are getting your questions answered. This question just submitted by Jackie Stratman, and it's for Dr. Johnson. So Dr. Johnson, what is the hardest surgery you have ever had to do on an athlete?
Well, there's one time that a young man had a failed Latarjet procedure, which is a procedure where there's a bone block missing, and he'd already had 3 or 4 surgeries, and his shoulder was still unstable. So we had to plan a specially constructed graft to fit the defect. And everything was scarred, so there's very few normal landmarks. There's a lot of sensitive structures around there. But as with all surgery, you take your time, you're careful. It's like driving. There's school zones and there's highway zones, and that was a school zone surgery.
Okay, Dr. Johnson, thank you.
We have more questions for the doctors when we come back. First, though, here's some trivia for you. What % of all injuries during childhood are sports-related injuries? Is it A, 22%, B, 46%, C, 33%, or D, 50%? We'll have the answer when we come back.
And if you have a sports injury related question you want answered, join in on the conversation right now. You can submit your question. It's pretty easy to do. All you have to do is send it on over to connectedktiv.com and it might be answered on air. Stay with us. We're back with this leading team of doctors on the other side of the break. Recovery Road, Inside Sports Medicine. We're back with continuing coverage of our special tonight. And as we continue our coverage, which % of all injuries during childhood are sports-related injuries? We asked you this question going into break. Is it A, 22%, or is it D, 50%, C, 33%? Well, you see the answer there. If you chose C, 33%, you are correct. And of course, you can join in on the conversation happening now inside the KTIV studio by submitting your sports injury-related question to CNOS panels of orthopedic surgeons right now on location. So join in. All you have to do is send your question to connectedktiv.com. It might be answered right here, live on air.
So back to those questions and back to our panels of orthopedic surgeons. Dr. Physical, I want to start with you with the next question. You specialize in foot and ankle cases, so this question is for you. It's common for athletes to have foot or ankle injuries. What's the cause of chronic pain, though, after you get that ankle sprain?
Yeah, so typically, when you sprain your ankle, a lot of time you can just walk away, don't have any pain at all. A lot of time you sprain the ankle and then having something that's still painful and just linger, doesn't want to go away. I think the big three that is common is, one is the cartilage damage. So when you sprain your ankle so hard, the bone, when it's twisted, it actually ding against each other, knock off a piece of cartilage, causing chronic pain. Second thing is impingement. Impingement could be soft tissue, like inflamed lining tissue around the joint, causing irritation, or having a bone spur that keep pinching every time we move. And the last thing is a tendon injury. There's a couple tendons called peroneal tendons. It's on the outside of the ankle joint. Those are very critical in stabilizing our ankles. So when you sprain your ankle so often, the tendon has reached its limit and it's actually torn and become chronic pain on the outside of the ankle joint. So there's a lot of reasons that can be the chronic pain after ankle sprains.
Bottom line, if you have chronic ankle pain, see a doctor.
Yep, exactly.
So chronic pain, it's pretty common, especially in athletes with recurring injuries. This next question, Dr. Meese, it's for you. You need a team, really, when you help an athlete fight through that long-term injury. What's the benefit of working closely with the CNOS Orthopedic Urgent Care team?
Well, I tell you what, we have had so much success with that program, and we have some really great providers helping over there who are truly experts in orthopedics. They work really hard, and it's a great product for the community because nobody wants to have an injury or something wrong and then call up and ask for an appointment and find out it's going to be 2 weeks to find anything out. And so many of our busy clinicians don't have open spots to get in right away. So it's a great service to be able to show up and say, hey, I don't know how bad this is, but I hurt my ankle or my wrist or my elbow, whatever it is. And it might be as simple as just having a quick x-ray and being released to go home, and that's all you have to have. But they act as very much like a triage service for our clinic. And so if somebody comes in with something that's more severe and needs to be seen urgently, they can process that quickly. You get hurt on Monday, you come in on Tuesday, maybe get your MRI completed the next day and see a specialist in whatever specialty it needs to be done, whether it's sports medicine or shoulder or joints or spine, and get your answers quickly, because there are some conditions, if we don't treat relatively quickly, we could kind of lose our opportunity to do something that's best for the patient. Other times they come in and might be, well, we'll just give you an injection and we'll wait a little bit and you can follow up with one of our specialists in 2 or 3 weeks safely. So it helps to make sure people get the care they need when they need it. And for those who don't need any specialized care, it might just be a quick x-ray and they're out the door with some medications and some rehab and they get what they need pretty quickly. So on our end, it is helpful to triage these patients and make sure they get what they need quickly.
Of course. Dr. Meese, thank you. Dr. Locker, you grew up in the OC. For those at home, that's Orange City. You also went to Northwestern College. What's your experience been like being the Northwestern sports medicine physician and treating those young athletes with injuries?
Yeah, it's been a great experience. I grew up in Orange City, went to Northwestern, so I was familiar with the college, and I think they have a lot of success as athletic programs, but they also do a really good job of training those young people to be people of good character and that kind of thing. So you get the opportunity to meet and interact with a lot of great young athletes, and they have a really strong team of providers. So very similar to what used to be with the urgent care, but they have a really good group of athletic trainers and physical therapists and primary care sports medicine physicians that all work really well together, because most of those injuries they can play through or not need a surgery to get better. But they're really good at those ones that do. They streamline that process to get them seen and taken care of effectively. So it's really nice to work with them. What's
it like working with those athletes that are on scholarship and they want to be out on the field or they want to be out on the court and they may get injured, but they want to get out there probably faster than you'd like?
Yeah, so I think it's important to just set expectations and just try and communicate the reason we're going slow is because we want you to get better and get back to those things and not have this be a lingering issue that, plagues them throughout their career.
Yeah. So. Go Raiders.
Yep, exactly.
All right. We now have a viewer-submitted question. Dr. Physical, this one's for you. It's a question submitted by Peyton Bonham. How do you determine whether or not an athlete is ready to return to their sport after an injury?
Yeah, great question. It's a common problem, actually. So there's many ways to do it. In general, we work closely with athletic trainers and physical therapists. They have ways to determine, because athletes, we need to go through step by step. Usually pain control, immobilization, try to get the motion going, try to get the strength improved. Once they're getting better, they go into sport-specific training programs so then get to be better and get close to their function. At the end, our team of therapists and trainers can actually tell when they are ready for it. But in general rule is that if, for example, a patient is injured on a right side, right knee or right ankle, then we have a test. So they have a jumping test by testing the jumping distance between the normal leg and the injured leg. If the injured leg is at 90% distance of the jumping of the other side, then you are ready to roll.
All right. Dr. Physical, thank you so much.
Yep.
And you can join us in the conversation right now. If you have a sports injury related question, you can send it to connect@ktiv.com and might be answered on air. Assessment, detection, and treatment. Our questions continue tonight for Dr. Johnson, Dr. Bissell, and Dr. Carreau. Doctors, of course, thanks for continuing to answer those questions. And Dr. Bissell, this question is going to be for you tonight. You actually work a lot with area college athletes serving in a position that helps them each and every single day as a Briarcliff University sports medicine physician. So Dr. Bissell, what does your involvement look like as the Briarcliff sports medicine physician? Walk us through your role.
Yeah, that's a very rewarding part of my practice.
Yeah.
Basically, what it involves is covering the home football teams, so being on the sidelines, just evaluating the injuries as they pop up, helping athletes decide if they can get back in the game or if they need to stay out. And you never know what'll pop up. The other week, somebody dislocated their elbow and able to, pop it back in for them. And then Monday evening, I go to training room on the campus at Briarcliff and just evaluate whatever student athletes need evaluated with the trainers. So, all the sports, wrestling, softball, volleyball, and just whether they just need reassurance or if they need an MRI or surgery, whatever needs done, take care of it. And then just throughout the week, as things pop up, we may see people in the office and just help these athletes stay on track and get better.
And do you find patience is key for those athletes when they do injure themselves and want to get back to the game?
Yeah, they are motivated and they want to get back.
All right, Dr. Bissell, thank you for that. And Dr. Johnson has actually completed more than 4,000 shoulder surgeries. So Dr. Johnson, what have you learned throughout your experience with these complex procedures?
Well, many of the surgeries that I do today didn't exist during my training, and there's certain principles that never change.
Okay.
You never do something that isn't going to be ultimately designed to give the best possible outcome. In matters of style, fluid like the wind. In matters of principles, rock like Gibraltar. You never compromise on that, and look for the principles that are going to best optimize those outcomes, and then you'll know how to adapt and use your experience for the new things.
Yeah, definitely so. All right, Dr. Johnson, thank you. Orthopedic surgeons, of course, are experts in managing fractures, dislocations, and soft tissue surgeries and those injuries. So one common goal is to restore that injury to normal function, which allows the patient, of course, to regain strength and movement. So Dr. Carreau, this question is for you. What advice would you give to someone interested in pursuing a career in sports medicine or orthopedics?
Sure, that's a great question. I guess I would tell you the first thing to understand is to become an orthopedic surgeon and a sports medicine specialist, it's a really long road. And the good news is, though, that path is pretty much paved. I mean, as long as you work hard in undergrad, you get into med school, you work hard in med school, you get into a good orthopedic program, it's yours. So it's just you gotta go and get it. I think you got to ignore the noise. You got to have some long-term vision, have some perseverance and some grit, and just be ready to go to work, because it's a long road, but it's very worthwhile.
And so did you personally have a love for sports?
Yeah, I did. Yeah, like most guys growing up, love sports.
All right, Dr. Carreau, thank you for that. And we have more questions for the doctors when we return. But first, here's another trivia question for you tonight at home. Women are how many times more likely to experience an ACL tear compared to men? Is it A, 8, B, 3, C, 4, or D, 10 times more likely? That answer when we return after the break.
And don't forget to join the live conversation. Send your sports injury related questions to connect@ktiv.com for a chance to have them answered on air. We'll be right back. Welcome back to Recovery Road Inside Sports Medicine. A moment ago, we asked you a question. Now we're going to give you the answer. Women are up to how many times more likely to experience an ACL tear than men? 8, 3, 4, or 10? The magic answer is A. Women are up to 8 times more likely to experience an ACL tear than men. And don't forget, we're still answering your questions right now. Simply send them to connect@ktiv.com for a chance for them to be answered on our digital cast right after this.
Yeah, and Recovery Road Inside Sports Medicine. Welcome back. The conversation continues with Dr. Johnson, Bissell, and Dr. Carew. And doctors, as we continue our coverage tonight, a lot of great information. So let's get into the next question. Dr. Carew, this question is for you. Someone comes in with a sports injury. They typically get some sort of imaging done during that initial visit. So why is it so important, and what role does imaging like a MRI or X-ray play in diagnosing a sports injury?
Yeah, the imaging is a very, very important part of orthopedics, and I would argue that the X-rays are almost part of a standard orthopedic workup and exam. So we pretty much always start with X-rays, and that really does help focus our treatment and help hone our diagnosis. But I would tell you, even in 2024, we're pretty good with a history and a physical exam. So often, when we're ordering more advanced imaging, such as an MRI, we're not usually trying to make a diagnosis. Often it's to help us with surgical decision making. We're often pretty good at just picking up what the diagnosis is. From there, it's the MRI will help us determine what's the degree of the tear, does this need a surgery, what's the likelihood that non-operative management with injections or physical therapy is going to help this patient.
So basically, what are the options moving forward?
Correct.
All right, Dr. Carew, thank you for that. And Dr. Bissell, we have another question for you this evening. This is a general question about the steps you actually took throughout your career leading you to sports medicine. So the question coming in is, describe your experience while going through your fellowship training in sports medicine.
Yeah, the fellowship training comes after our medical school and residency, so we already know how to operate, we know how to treat patients. It just gives us a chance to get some additional specialized training in sports medicine at a high level. So I went to University of Michigan, and it was a good, rewarding experience. I got to work with all the sports, be on the sideline for the University of Nebraska or University of Michigan football team, and work with some elite athletes and some very accomplished sports medicine surgeons. So I learned a lot and had a lot of fun.
All right, Dr. Bissell, thank you for that.
That's all the time we have for our special Recovery Road Inside Sports Medicine right here on KTIV. We'll continue this conversation, though, on our digital platforms. That's the News 4 Now app, our Facebook page, and KTIV.com.
That's right. So let's go ahead and submit your question to connect@ktiv.com for a chance for it to be answered. And of course, we want to thank all of our doctors from CNOS, the orthopedic surgeons here tonight answering your questions. And welcome back to Recovery Road Inside Sports Medicine. I'm Jessica Bowman, and we have a live conversation happening right now with a panel of orthopedic surgeons from CNOS answering your questions about sports-related injuries. So once again, I'm joined with Dr. Johnson, Dr. Bissell, and Dr. Carew. And doctors, thanks for continuing the conversation tonight. So let's turn our attention back to Dr. Johnson. We have a question for you tonight, just submitted by a viewer. And this question just sent in for athletic injuries. So it says, ice or heat for athletic injuries? I've heard both. Which one is right?
It's a good question. Ice tends to be better for a joint injury with inflammation and swelling. Heat tends to be better with sore muscles.
Oh.
Turns out you can have both. And so use one or the other. You can overdose on ice. It's called frostbite.
Okay.
You can overdose on the heat, and that's called a burn. So you don't want to expose yourself to bare skin. But both can really help you. Unbalanced, ice tends to help more. Ice tends to help the inflammation calm down and get you back quicker. But sometimes a little well-placed moist heat can help your muscles warm back up easier.
So is it good to kind of alternate 30 minutes ice, 30 minutes of heat?
You can. It's patient-specific, honestly.
Okay.
It's patient-specific. Ice tends to have more solid evidence in the shoulder for recovery, and it's not as well supported by the literature in other knees and ankle injuries. But there's patients that love it, and they do respond to it. So the key is that you don't overdose, and that it's what we call supportive care.
Yeah.
You titrate the dose to the effect.
Okay, all right, Dr. Johnson, thank you for that. And so it looks like we have another question coming in from a viewer that just submitted this. It says, well, actually, we're going to get to that question in just a minute. But first, I want to remind you, if you are just joining us here digitally on News 4 Now or KTIV.com, you can join in the conversation right now and have your sports-related injury question answered by our panel of 6 CNOS orthopedic surgeons. All you have to do is submit it to connect@KTIV.com.
Once again, I'm joined by Doctors Locker, Meese, and Physical, continuing to offer their expertise to your sports injury-related questions. I want to start with Dr. Physical. This one is for you. You deal with the ankles, but part of the body that gets injured over and over again. What advice do you have for athletes who worry about re-injuring their ankles?
Well, the first step is to make sure, with a good exam and good clinical evaluation, that the ankle is actually ready to roll. So it's not unstable, and it has good motion and good strength. Then the athlete will feel like, are we ready to go back? Then there's a fine line between going back too soon or too late. So if there's any hesitation, we work with trainers, therapists, and nowadays we have sports psychologists too. If athletes are really afraid of certain things and need some confidence, need professional care to build their strength to go back to sports, I think that would be a way to go too.
Very good. Thank you, Dr. Physical. More viewer-submitted questions. Dr. Meese, this one is for you. We're literally this close to having my producer read the question into my ear. That's how quickly we're getting in these questions. So is it a requirement of an orthopedic surgeon to have been an athlete before?
I don't think it's a requirement. I do think there's some advantage if you're being a sports medicine physician, having a really good understanding of what happens in sports, what happens in the locker room, on the field. I think if you've never been exposed to those conditions, you might have a disadvantage. But there are a lot of orthopedic surgeons who are not sports surgeons. So there are hand surgeons and joint surgeons and those who do tumors. So in the sports medicine realm, I think you carry a lot more weight when you talk to an athlete in the language they're used to hearing. And so if you don't know that language, you lose some credibility a little bit. But that's just for sports medicine so much. So you can hate sports all you want to be an orthopedic surgeon.
Very good. Folks, keep sending your questions. Connect@KTIV.com. Our doctors will continue to answer them as you send them in. We want to talk a little bit with our doctors overall about, and you mentioned a moment ago, Dr. Physical, and this is coming off the top of my head. You mentioned the psychological aspect of healing. Doctors Locker, Meese, and Physical, how important is it for an athlete to be in the right mindset as they go through recovery, physical therapy, following all those steps so they can get back to the field or the rink?
I can take this if you want. I've had all this in my house here lately. So, I think it's been in the dark far too long how the injured athlete feels emotionally and psychologically. And you can imagine these kids who really pour their hearts and souls into honing their craft. What they are as an athlete sometimes becomes their persona. It's who they are. And so when they have an injury, they're not just dealing with the discomfort of a severe physical injury like a bad knee injury that has a lot of pain with it. they're also taken away from everything that's their passion. They lose their ability to be on the court, to be at practice. And much of their friend group is typically the kids they play with. So they're taken away from their friends who are still doing the things that they love to do. And they can really get to a deep, dark place. And, especially if they have a bad injury that requires an operation. Now they might miss some school, they're behind in school, they haven't seen their friends. And those kids do need some help. And I think as orthopedic surgeons, especially in the sports realm, we're all kind of amateur psychologists. We're not real good at it, but we kind of understand that process a little bit. And it's been enlightening, and I'm glad it's happened this way, that in professional sports, this has become something very popular, to know that someone might need a mental performance coach or a sports psychologist. And much of the Division I football teams and basketball teams have these people with them. Pro golfers, I know in full swing, has been a big thing online also. So I think I'm really glad it's come to the forefront. It's not taboo anymore, and I think kids can get a lot of help if they know where to go for that kind of help.
Drs. Locker, physical, you want to weigh in before we send it back over to the other panel?
I think you said it well.
Enough said?
Yeah.
I thought so too. Dr. Reese, thank you.
All right, so don't forget, you can submit your question right now to KTIV.com. All right, it looks like we got a new question in. What are the most common sports injuries you see in your practice? Dr. Locker, we're going to ask you that question.
Yeah. So we see a lot of, knee and shoulder injuries. So ligament injuries of the knee are very common. Meniscus injuries are very common, and some combination of those. We also see, especially in our contact sports, shoulder instability, labral injuries. And then we see as some of our athletes age and are still doing stuff, things like rotator cuff tears, and even dealing with arthritis and, managing symptoms of arthritis while trying to keep people active are all very common things we deal with and see.
All right. Thank you, Dr. Locker. We know how common sports injuries are. Why don't we get the next question up for us? Thank you, Cade. Next question coming in from our viewers. How do you see sports injuries affect an athlete's mental health? And I think we addressed that just a moment ago, Dr. Meese. But obviously, you're a father of a daughter and a son. You have kids who are athletes, and chances are they've experienced injuries. What's it like to deal with that for that first injury, the first major injury that they've had, and they've never had a setback before?
Well, similar, I guess, kind of piggybacking on the last answer, but it can be really devastating for the athlete, and honestly, it's devastating for everybody around them. It hurts you as a parent, it hurts their siblings, their friends. It's when someone puts that much time into something that they really love, and you see that taken away from them, it hurts everybody involved. So I think, and that takes time. It doesn't go away in a day or a week, and sometimes it's the injury, and then you wait, then you have a surgery, then it gets worse again because the surgery is painful. So it's a lot of anguish for everybody involved for a while. And so it's having experienced that myself with kids, I understand probably better now than I ever did about what these kids are going through. And I feel bad for every one of them that walks through the door with an injury like that.
Dr. Meese, thank you. Jess?
All right, another question coming in from one of our viewers, and Dr. Crow, this is for you. All right, so the question is, as we get older, what can be done to prevent an injury?
Well, I think the most important thing, when people get hurt, it's usually because of loss of mobility or loss of strength. They don't have the strength or the quickness to protect themselves from a fall. And if they do fall, they don't have the strength to support themselves as they go to the ground. So I'm a huge advocate for exercise, weight training in all walks of life. It doesn't matter if you're 70 or 17. Doing resistance training to keep your bones strong, your joints strong, your muscles strong is of paramount importance for injury prevention.
And talk about athletes that are coming back to the game. They've gone through the injury, they've gone through surgery, and they come back to you. They're ready to get back on the field. How rewarding is it to see them completely healed?
Yeah, it's really rewarding. It makes me feel good, but at the end of the day, I'm just really happy for the kid. That's one of the best visits I have. Yeah. Is maybe somebody who's going through a big ACL surgery or a ligament surgery or something of the like, and we're right at that return to sport, and to give them the green card to say, hey, you're good to go. It's a lot of smiles in the office, and parents are happy, and that's a great part of my job.
Awesome. Thank you for that. And Dr. Johnson, a viewer just submitted a question for you. So let's get to this question. It says, my left knee bothers me now and then, kind of even just moving from time to time. Bone sticks out more. Is this something that should be checked, an old injury due to a fall? So Dr. Johnson, how would you respond to that?
Well, it's hard to understand what the question what it is asking,
okay.
but I would say, yeah, if it's bothering, come get it evaluated.
Yeah.
It's an easy enough thing to do. with a nice physical exam and an x-ray, we can give you a ton of information. Almost always we'll get you on the right path immediately.
Better safe than sorry, right?
That's right. That's right.
Dr. Bissell, we have a question for you coming up by one of our viewers. Let's get to that question. All right, when you have an older person fall and break a bone, so unfortunate, does CNOS do a bone health screening to prevent further fractures to make sure there's not an underlying disease or illness? So maybe not a sports-related injury question here, but do you have a response to that, Dr. Bissell?
Yeah, that is a common problem we see, and of course, the primary focus is, treating the fracture, getting that person better, whether that's cast or surgery. But that's a great question because oftentimes as we age, some people's bones get weaker, and we can evaluate that with a DEXA scan to see if you have osteoporosis or osteopenia, if you might be at risk for fracturing your bones easier in the future. And then depending on the results of that, that could be treated.
So there could be some underlying issues there.
Yeah, especially if you've had more than one fracture, we would be more concerned that your bones might be fragile.
Okay, Dr. Bissell, thank you for that. Now a question coming in by a viewer. Let's get to that question. How long is the average healing time for a green stick collarbone break? Dr. Johnson, do you want to take this one?
Sure. So green sticks are not displaced. The goal of a treatment in this kind of a fracture is to keep a minimally displaced fracture minimally displaced until it heals, or non-operative until it keep a non-operative fracture non-operative. And so usually about 6 weeks you'll see good evidence of healing. Sometimes when people have physiologic problems like diabetes, or if they're smoking, their healing can be delayed. But usually by 6 weeks, you'll see good radiographic evidence of healing. Once you see that, you can start strengthening and progressing with therapy.
Dr. Johnson, thanks. And Dr. Crow, we have another question coming in from a viewer. And so they would like to ask you, let's see, it is, well, it doesn't look like it's there. So Dr. Crow, any advice to any maybe athletes out there watching? Just kind of maybe, is there any preventative measures that they can take while on the field?
Yeah, there certainly are. And it kind of piggybacks your previous question about strength training. That also applies to high school and college age athletes. There's a lot of specialized strength training we can do, and we can focus certain aspects of strength training based on the sex of the individual too. Specifically, as females are far more likely for knee injuries, like we reviewed earlier. So there are special strength training protocols we can send those athletes through to help prevent knee injuries. So it's mobility, strength training, balance training, and by balance training I mean equalizing the muscle strength of all the groups in the lower and upper extremity. Trying to identify those imbalances and then try to correct them. We think by doing that, working on a person's landing mechanics, we can prevent injury.
Okay, so is there any type of athlete that you work with, I know, or maybe it's a myth, that athletes can work out too much?
Yeah, I think it can be counterproductive. I mean, the body has to heal. If you overload skeletal muscle too much and at too much of a frequency, it is counterproductive. You'll see a drop in growth hormone. You'll see reduction in the body's ability to actually heal some of those micro injuries that are sustained during that heavy exercise. So it can be. And now I wouldn't say there's like a perfect recipe for exactly what the correct frequency is, but generally speaking, each muscle group probably no more than 1 time per week seems to be about the right sweet spot for muscle recovery and growth.
All right, Dr. Groh, thank you. Matt, we're going to send things back over to you.
All right, this question is for Dr. Locker. Dr. Locker, our viewer asks this: do you work in conjunction with chiropractic care to treat sports injuries?
Yeah, we don't necessarily work directly with any providers in chiropractics, but we see a lot of patients who, they're seeing for musculoskeletal complaints, and I feel like a lot of the patients we see are those that, they're getting care and maybe have an injury that's beyond what that can treat, especially if it's something surgical, and that is where our paths tend to cross quite a bit. Or those people that, are dealing with some pain and stuff that there's not a surgical answer for, but there's good, alternative methods to help treat that pain and get them feeling better.
Very good. Additional questions coming in from our viewers. Let's roll it. With the exponential growth of pickleball, played it myself, great sport, what are the most common pickleball injuries that you see? Things like wrist fractures, knee injuries, shoulder injuries. Dr. Meese, what do you see?
Well, I think I have a resident expert in pickleball sitting right next to me, but I'll go with the injury part of it. Dr. Physical is a high-level pickleball player and plays in tournaments. So I think we see a lot of injuries in pickleball, and I don't think you don't see as many in younger athletes, but I think the concern is if somebody's 60 years old and picks up pickleball, and you're going to ask them to sprint and change directions quickly, which they haven't done in 40 years, expect some things to go wrong. And so I think it's important that people who want to play this game regularly kind of ease and keep themselves in shape. And so learn to change directions, or maybe they play doubles first before they play singles. So we see a lot of ankle sprains. I've even had people tear their ACL playing pickleball. Wow. Lots of meniscus tears, just things that you have when you try to change directions quickly in your body. Maybe your strength and endurance, like Dr. Crow had said, aren't quite up to what they were the last time you tried to sprint 40 years ago. So I think it is important that people who want to play pickleball is to be in pretty good shape when you start and stay in good shape. And it's a very healthy thing to do. I mean, in terms of, it's great for a community because you play with friends and it's good exercise. But people should try to be in shape when they play.
Dr. Physical, I can't let this question go without addressing the praise that your fellow Dr. Meese laid upon you. You are a high-level pickleball player. So you tell me, have you injured yourself playing pickleball?
Yes.
Okay, elaborate, please.
A lot of times, it's not I injure myself. My friends hit the ball to me and hit my body left and right, and sometimes get to my mouth, get to my shoulder. Ooh. But it's all fun and healthy. So actually, I'm much healthier playing pickleball. I have friends who are in the 70s who actually can actually dominate the games. So but the key, as Dr. B said, start slow, let your body adapt, because pickleball is so fun and so addictive that you play one game, you want to play for 5 hours, and then the body cannot do it. So you need to take your time.
And it's all fun and games, folks, until you end up at CNOS. So take it easy when you're playing the pickleball, folks. That is all the time we have for our special Recovery Road Inside Sports Medicine on our digital platforms, the News 4 Now app, Facebook, and KTIV.com. We certainly want to thank our doctors as well.
Yeah, I know. It's been a great evening. So thanks for joining us tonight and joining in on this live conversation. Of course, we want to thank our orthopedic surgeons from CNOS for joining in on this live conversation and answering your questions.
If you want to rewatch tonight's special, Recovery Road Inside Sports Medicine, you can do so right now on the KTIV News 4 Now app. It's on your smart TV. You can also visit our website, KTIV.com. And of course, thanks to CNOS for having their professional orthopedic surgeons in studio tonight to answer your questions.
Thanks for joining us. Have a great night.